Welcome to Ask an Expert, hosted by Chicago's Black Business Network. Our upcoming guest is Fallon M. Nursing Education Specialist.
Chef, wow, powerful, powerful stuff. And again, like you said, Miss Ramona, really, really good to see some brothers combine together and talk about health and what that means. And I think this is a great segue for our next expert that we're going to have, Miss Fallon Flowers, who's a nursing education specialist. So, Miss Flowers, please unmute yourself and go ahead and join us and share your expertise.
Absolutely. Thank you so much for having me. And I'm honored to be here and also to follow behind Chef Keedy, who has been, just having a whole lifetime of health and wellness and giving back not only of himself, but just for others, especially with that many books. My God, I mean, hats off to you. Absolutely, indeed, sir. And I'm so also just very grateful to follow behind Miss Ramona and just being invited here today. And so, as mentioned, my area of expertise is surrounding nursing education. And so I'm otherwise known as the Black Pre-Nursing Coach. I am a board certified women's health nurse practitioner. I've been in nursing altogether for the last 13 years. And as a nurse practitioner for going on the last 7 years. I specifically work in women's health. So I'm a board certified women's health nurse practitioner. But how my story got started and just my background behind what I do is because we've all seen that there's just a shortage in nursing in general. And we've really seen this, especially since the pandemic, started, and how there was just a lot of health disparities that were really brought up. And Miss Sonia actually kind of pointed that out about what showed up in the Healthy Chicago 2.0 and so many other reports about the health disparities, but especially in Black communities. But I had an opportunity many years ago to teach about a career in nursing to high school students and give them the experience and prepare them to apply to nursing school. And I did this time and time again for about 5 years. And I looked up at that group, and over the time period that I was doing this and providing this opportunity for these high school students to be exposed to a career in nursing, very few were Black. And so from that, I decided to try to make sure to make efforts for more students of color or people that look like me to join the industry. However, the program that I was teaching with did not want us to do our own marketing. And so that's where I wound up deciding to go out on my own and create programming and education and visit high schools and start helping students who wanted to go into nursing. And people started sending their nieces and cousins and daughters, et cetera, to me that had a interest in a career in nursing. And so that's kind of where my background lies with that. But it wasn't just the fact that I didn't see enough Black students and they were kind of blocking the way, so to speak, of me helping students of color to learn. But I know from being Black, from being from the South Side of Chicago, I see what Miss Sonia talks about every single day, especially in my work as a nurse practitioner. I see it every single day, the health disparities, the medical mistrust every single day, how people don't want to come to the doctor. And when they do come, they don't believe what we say and they want to, and all of these things, or they don't believe it until they hear it from a Black provider. And they don't believe it until they have someone that looks like them. And so when we have medical mistrust, something that we know that helps that is something called racial congruence, or sometimes called racial concordance. So when we have people that look like us, we're a lot more likely to share our experiences, to be more open to the advice that they're giving, to listen, to try something different, to try something new. I mean, we just heard it right here on this call, some questions and things that were being asked about, hey, well, what do you think about this? And so that really makes a difference. So not only is racial concordance important, but again, going back to what they sometimes call the Fauci effect from the pandemic, which was of course, Fauci talking about everything related to COVID. And a lot of people decided that they wanted to go into a field of nursing. However, what a lot of people don't know and a lot of people don't realize is that A lot of people think, oh, I'm going to go to college, for instance. I'm going to go and I'm going to go be a psychology major, or I'm going to be a journalism major. Yes, you can do that with certain industries, but nursing, unfortunately, is not one that you can just go and do. It's very complex. It's a little all over the place. There's a lots of different paths. The thing is that when we think about entering the field of healthcare in general, especially like when we think about medicine, it's very streamlined. Most people, when they know that they want to be an MD, they start in high school, they start working on those grades, those extracurriculars, and doing all the things that they need to do to make sure that they're fully prepared to get into that career. So by the time they're accepted into the college that they want to go to, they know that that college is pretty much a pipeline straight into medical school. And then they go to medical school, and then they do their residency, and voila, they're a doctor. It doesn't work that way, unfortunately, when it comes to nursing. And what I also saw in my path, in my journey a long time, was that I was seeing a lot of Caucasian and non-Black students who were in their young 20s going for the same path that I was as a nurse practitioner as what I am today. But meanwhile, those same young 20-somethings at the time that were Black were just regrouping themselves after going to college for a year, failing out, and having to restart again, go to a community college just to get started. So they were in the pre-nursing phase of the whole, educational path. Meanwhile, I had Caucasian classmates who had already been in the pre-nursing phase. They had already become a nurse, and they were already in nurse practitioner school, getting ready to come out and make that bank. And it's just like, why do we have such a difference and a disparity where we keep seeing our Black students and that Black youth being sent away to college, and then, all don't make it through that first year or that first couple of years. And then next thing you know, they're coming back and they're trying to go back. It's like they're going backwards. And I'm not just saying it as a they, I really need to say it as a we, because that was also a part of my story too. I'm someone who went away to college, wasn't fully ready, didn't pass my first year, but tenacity and God stayed with me. And I pushed through, and I went to community college, finished my degree there, came back to the university, finished that. Then I went to nursing school. So I was one of those students. But it doesn't make any sense. If you are a student and you are in high school and you know that this is something that you want to do, why are we going all these different ways, misguided? You don't have a coach, you don't have a guide, you don't have somebody that's been there before you, and you waste a lot of time and a lot of money because a lot of advisors are not advising correctly. They didn't go down the nursing path, and they're only assisting these students to make sure that that they are tailored to go to that school's nursing program, not all programs. But what a lot of people don't know is that there is high percentage rates of students being turned away. And this is qualified applicants. We're talking about, 67,000 students a year, 70 something thousand students a year that have the grades and have the GPA, have those test scores and everything, but they're still being turned away. You can imagine how many of those students are Black, that are being turned away from nursing programs. So although I'm primarily talking about high school and young people, I work with all people, people of all ages that are Black men and women who want to be nurses. But I really want to make sure that when I help people, that I'm helping them to save the most time and the most money as possible with things that I have done for myself and things that I've helped other students with. And so that's primarily what I do. And then, also I put on programming throughout the year as well when it comes to electronic and in-person events and things like that, and work with high schools, mentor groups, youth development. If you have a church, sorority, fraternity, human resources, whatever that thing is, that group or organization I love to partner with. But really, here I am today. I just want to make sure that if anybody wants to go in healthcare, they want to know the difference between all the types of nursing, they want to compare it to MD, to PA, they have a loved one that wants to go into healthcare nursing, to please ask me, ask away what you want to ask, or if it's anything, off topic from this, women's health related, I got you on that too.
That's phenomenal, Fallon. Thank you so much. I love that you're doing that. I'll start off the questioning here. I'm a little bit younger than Philip. I always give him a hard time on that. But Back in the day, I used to see where a lot of Black women, Black men, if you will, were going into either teaching and nursing. And I think that was because, educationally, that's where they kind of pushed us towards, right? Our
Mm-hmm.
counselors pushed us towards. And I'm married to a physician now. So my question is, why do you think that we are seeing such a shortage in people of color going into that field, knowing that there is so much opportunity and, like you said, room for growth, and we see the disparities there. Um,
Mm-hmm.
I personally know of about 2 or 3 travel nurses that are, like you said, getting that bag. They are making some
Mm-hmm.
serious money, right? So what could you share
Yes.
with us that maybe we can kind of put to the new youth, or maybe those that realize, either college or some other type of field is not for them, but maybe nursing or this type of healthcare where we see the disparities could be taken advantage of.
Thank you so much for that question. And I want to say also thanks to your wife for her service. Because
Sure thing.
it's something out here. It really is day and age to be serving in healthcare. But I would say the reason why we're not part of why we're not seeing it is still because I say exposure is key. So I like to say that a lot. And also for some people, it's still the aspect of it's hard to be what you don't see. So like literally today, I went with my mother to the doctor's appointment. The doctor was white, the resident was white, the nurse was white. Only the medical assistant and the front desk check-in staff was Black. That's it. You know, so and we could all think about that when we go and we're in the healthcare setting. If we go to the ER for ourselves, urgent care, immediate care, if we go with a family member, when we go to the doctor's office for our annual physical or whatever that is, how many times do you see a Black doctor, a Black nurse, a Black nurse practitioner? It's quite hard to see, to imagine yourself doing that. And sometimes I think we don't give ourselves enough credit and realizing, no, I actually can do that, and every time I have a patient that says, I'm a CNA or I'm in nursing school or, I think I want to do what you do, I encourage them. I know not supposed to be talking about all that stuff, but I pull up websites. I'm showing them stuff because I want them to do this. It's like, don't sell yourself short. I understand taking the stepwise approach for retirement money if you want to do CNA and MA and some of these other things first, but don't get stuck there because that's what that happens a lot to our people. When we look in nursing homes especially, you see a lot of Black LPNs, which is a licensed practical nurse. And so that is a nurse. However, that's not someone who can kind of go up further on a ladder because, that's just kind of the way nursing works. And then we also see a lot of Black CNAs. We see a lot of Black medical assistants, and they're coming into the entry level either for the purpose of becoming a nurse later, or they just do that because that's just what they saw, or that was the cheapest or the fastest thing to do, but they don't go beyond that. So one is the exposure, but the other thing is really the encouragement and the support system. I have talked to so many people who said that they were on their way to nursing or they were considering nursing, but their high school counselor or their college counselor told them that maybe they should think about something else, that maybe nursing isn't for you. This is not your career path. How can you say that? You didn't go through the rigors of nursing school.
Right.
How can you say this to this student? I and this was not even a Black student. This was a white student that told me this, but it still crushed me. This young lady told me that she was told by her counselor that she shouldn't go into nursing because she has anxiety disorder. Who are you?
That's terrible. Yeah, just to lead
How
them
many
astray.
people everybody has some type of mental health condition. And we all work on it and work through it in different ways, no matter if it's prayer, meditation, medication, faith system, whatever that is. But who are you to stop somebody from their future career path? This person has this compassion and they want to do this. This is a hard, a hard career path. We see people from birth to death at their sickest, disability, death, all of that, you know. And we take a lot of abuse and we also take a lot of abuse to our own bodies and to our own families and lifestyles. And it's like, if you actually have somebody who wants to do this and they have the compassion for health, for better and betterment, not only of their own health, but their families and communities, why would you stop them? but every single day, students and people come to me with their testimony and tell me, and people who are nurses and stuff, they tell me that their counselor told them that they shouldn't be a nurse.
Yeah, and it doesn't surprise me because I do know of a few friends and colleagues from, from undergrad that were, they were led astray, right? Just, which is why we're seeing the disparities, if you will, with all the new tech industries and everything there. So it looks like we have two questions for you. I'm not sure who came in first, so I'm going to start with you, Ramona Miles, and then I'll come to you, Chef Chidi.
Thank you. Hi, Fallon.
Hi, Ramona.
Hats off to you for what you do. My mom was a nurse for 32 years, and I had heard it all. I'm sure a lot, right? A lot of what I had in mind to ask has been answered, but here at the end, something similar happened to me. I wanted to go in that direction, and my counselor, when I was in high school, told me don't. And she said a few other things, and I think you're right. I know you're right about this, but I was just thinking about myself, and I haven't thought about this in a very long time, how often that happens, and it crushes more than just one dream, because I'm 56 now, and I'm just now in the last 5 years overcoming a lot of things that were said I couldn't do in high school,
Yeah.
by someone that you trust, your guidance counselor, someone you go to, you confide in, and when she told me that, I just was lost for a moment. And then the home structure wasn't able to provide that for me, although my mom was a professional, and our family's full of teachers and educators and people that are in the nursing field. But for some reason, I later realized, okay, well, that wasn't my path, but I still ended up doing similar things, just wasn't in that particular field. But I still end up serving people in a way similar, I guess I could say. But I moved to Naperville, so my children were pretty much, all of them went through high school, elementary school and high school. My oldest two started in high school in Naperville. They have they have programs that I don't think are in other schools the same way it is out there in Naperville. What I was shocked to see is my daughter was offered like cosmetology courses that you could take to help you when you go to register for nursing school. So you would actually start, on that path. And this is while you're in high school, as early as a junior. Therefore, you're not coming out of pocket for some of the courses that you would have to take after you graduate. So I'm not that familiar with the nursing path, but it was shocking to see that. And a lot of the girls were more so encouraged to go to the nursing program, the Black girls were, versus anyone else, But I was surprised to even see that was an option. Like, so the schools that are on the South side, if they're not offering this, like you were saying, and these girls don't see a place for them because they don't see anybody that looks like them, or if they do, the person may be older or not very communicative, so they're not communicating any of the education or encouraging them, and for whatever reason. But I was thinking, if Naperville school has that, other suburban schools probably have similar programs. The girls, I told my daughter to let other people know that those programs exist so that they can maybe mention it to their schools and so on and so forth. And this was a few years ago, and she's out of high school and stuff now. But are there programs, or is there, how would you help schools, bring that information into their system? Because somebody's funding these programs in these, like in Naperville, they're getting funded. So is it funded by the community, or is it funded by the government? How is it funded where those other schools can get that? But if I'm not really sure if I'm asking a good question or not.
No, you actually are, bringing up some great points. And so that is one thing that we, see as well, partially about that disparity when it comes to exposure is the fact that, um, when there are areas that have more, money available to them, there's more opportunities to use those tax dollars to be able to make sure that programs are at those schools. And if it's not from the tax dollars, they find other creative ways to do that. On the South Side and just throughout Chicago, for instance, there is a program called the CTE, or Careers to Technical Education Program, within the Chicago Public Schools. However, there's, I think, about 8 schools spread out, and this is 8 out of the, I don't even know how many hundred high schools that we have that are CPS schools that have healthcare concentration. So you have to go to one of those schools. But one of the last things that I was aware of was that you have to live in that neighborhood to go to that school. So if you don't live in that neighborhood, you can't go to that career specific high school that talks about, nursing and being a doctor and pharmacist and all of these things. And then the funny thing is that students that don't even have a healthcare interest are still going to that school. So they're holding up space for students who actually want to go into healthcare. And so it's not it's not enough out there, I guess I say. There are summer programs and there are year-long programs out there that some programs offer, but some of those programs can cost. And so, that's kind of the challenge there, is that there's just not enough opportunity for everyone. And so, that's where some of the things that I was looking at is, putting on programming where I can do things en masse. So if they can bring all of the CPS students, even if it's all on one Zoom, or if they got an all school thing, or whatever we need to do to expose them to nursing. And that's, if that's me by myself, if that's me with a panel of nurses, we could definitely do that. Because I put on a couple of different television programs last year that focused on nursing, and one of them was specific to Black men in nursing last year, where I had a panel of Black men throughout the spectrum of nurses to make sure that they saw themselves and they weren't just hearing from me, but that they heard about nursing too. But there's definitely more work to be done for our students to be more exposed, absolutely. And that's just throughout the city in general, and not just the suburbs, but Black students too.
Yeah, no, that's some really good stuff there,
That's
Fallon.
amazing.
And thank you
Yeah.
for that question
Thank
too,
you.
Ramona, just to see the disparities too between the city and the suburbs, right? We know that there's going to be some different things there. Before we come to your question there, Chef Chidi, I wanted to add, I'm going to put in the chat, I've got a good buddy that finished medical school at Meharry, and he's a dentist, a very prominent dentist here in Chicago now, Black dentist. But he just shared with me, because I'm a member of a couple of different organizations, 100 Black Men and some Divine Nine fraternities and sororities and all there. But Tennessee State University and Meharry College have just created an accelerated program for Black doctors, particularly for dentists, because they have 0 Black male doctors in the program right now. 0. And so they have agreed to pay 100% tuition in medical school for any Black male that applies over the next 3 years into that program. It's an accelerated program. I'm gonna go ahead and put it in the chat there. If you all know of anyone, please share that. Let's get these brothers out there to start doing it, right? That smile's our calling card, right? You got to have things. But imagine if, you got some of these young brothers that are saying, I'm not seeing as you mentioned, the disparities, they're not seeing the representation, if you will, of them. But I know that cost can also be associated with why they're not attending for that. I know that was a big factor back when I attended school some years ago. But imagine you can go to undergrad and to medical school and have it 100% paid for because it's not there. I was telling my nephews about it, and they were like, "Man, Unc, I don't want to be a dentist." And I was like, "But it's paid for. Do you know how many doctors out there that don't practice? Do you know how many attorneys are out there that don't practice? Just go get the degree," right? Or something like that.
Gotta listen.
So, Chef Chidi, go for it with your question.
All right. First of all, congratulations on your life experience. Of all of the contacts and investigation I have of the medical industry, I am convinced, and I say this with all sincerity, it is the nurses who have earned our trust the most. And so I salute you and all the other nurses for what you do for gaining and retaining our trust. question I have for Nurse Fallon today. And I hope this is not off topic from what you do, from what you presented, but your eyes and your ears on the scene, I think, are very valuable to all of us. In the first 5 months of the COVID pandemic, Blacks in the US had the absolute highest death rate for all identifiable groups in the world. The United States had the highest national death rate. Yet across all Africa, except for 3 countries, Blacks had the lowest death rate from the diagnosis. How might you explain this disparity?
That's interesting. You know, I think if you're looking at a comparison from those in Africa versus us Africans here in America, there's a different cohesiveness, togetherness, you know, I think a collective trust, I think I'll say, a community that's there for them in the different areas. Here, we are so diverse and so spread out, I think, and we've all had so many different variant experiences with healthcare and the different decisions that we like to make when it comes to our own healthcare. And I just think that we are so independent here just in the US in general, and being able to just make up our minds that we're going to do whatever we want to do, however we want to do it, I think is one. But even more so as Blacks here in America, and just, you know, we have gotten tired of being told what to do sometimes. And so it's just like, hey, I'm gonna do me. And I think that's part of what's going on. And again, that medical mistrust is there. You know, I can believe it. I see it. I've felt it sometimes myself. You know, it's hard to take in what's going on when you know, and I think the other thing is the messages that were coming out. Because even myself as a healthcare professional, when they were saying at the time, and this is at the beginning, like you mentioned, in the first 5 months, oh, you don't have to wear a mask. Oh, now. If you're telling us that people are coughing, sneezing, laughing, why would you tell us we don't have to wear a mask? I mean, this is kind of common sense here, but you're telling us not to wear it. And then after we start seeing people at the local Walmart and at the grocery store, and our post office person is dying and all of this, and you're still saying on the news, no matter what, it's okay. No, you don't need to wear a mask. You know, that really, I think, makes us want to shut down and turn it off. You know, we turning off the computer, the social media. We're not listening to you and your news report, because obviously you don't know what you're talking about. And that's the honest truth. And so I think with us having more mistrust, we did our own thing. But with doing our own thing, and doing it in so many different ways, and then we still wanted to get together, you know, and we were exposing, and whole families, unfortunately, were dying. I mean, it's the most unbelievable thing when you see a mother, father, and all of their children all died, you know, because they still got together, and it's so hurtful, and it's such a shame that those folks lost their lives. They did what they wanted to do, but you know, at the end of the day, I really think it still goes back to the mistrust more than anything of what's happening here in the US, but furthermore, the collectivism.
Yeah, I think you're speaking some facts there for sure. Nurse Flowers there. We got 2 more questions for you, and then we'll move on to our next panelist there. Go ahead, Miss Sonia.
I just want to say, I'm going to have to jump in here, people. These some great conversations, and we know these some great conversations and some great questions, but we'll be here to midnight, people. I'm willing to stay. Okay.
All right, I got
But we
one
have a few
more after
people to
you
get
there,
to.
Miss Sonia. I'm gonna keep
So I
I'm gonna
had to
keep it
jump
moving.
on in here because Vince kind of laid back over there. Okay. So I'm gonna push him along a little bit over there. Put your questions in the chat room. Ms. Flowers can go over there and answer them for you. And that's a way of continuing the conversation so that we can go to some other people. Thank you so much for being with us. And I'm just gonna have to push Vince along a little bit because I like this going to midnight. But it's great. I wasn't expecting this, but I'm loving it. But I want to get to everyone, and let's see if we can move
phenomenal.
on.
Thanks, Miss Sonia. So Tina, I see Tina Padilla. I see that you have your hand raised. Do you mind going ahead and putting that in the chat, and we'll have Nurse Flowers address that. And I'd like to
Well,
bring to
this is actually a question for everybody,
okay, yeah,
because
please.
everything we're hearing, and it's with the nurse, thank you very much for everything you said is not only factual, you're speaking truth to power is what I'm feeling. You know, I'm hearing, but I'm also feeling. And one of the things I just want to put out there with the CT, whatever, the career things for CPS, what can we do as a collective, growing this community of concerned adults, helping children of, you know, that don't have direction? What can we do collectively to make more because my sister went to LPN school at Orr High School, and now she earned her, you know, degree from the university, and she's done well, whatever. Even starting at that LPN that she got when she was 18, you know, propelled her to where she is today. How can we make sure that our public schools have these programs for anybody who's interested? Collectively, that's
I think that's
for
great. I'd
everybody.
love to
It's
share
going to
it.
be doing, we have to do this as a community. One person alone, yeah, it's, they
Yeah, for
call us the
sure.
lone wolf, and they don't listen to us, and they don't care. They're not paying attention. Thank you for the time.
Yeah, no, thank you, Ms. Padilla. Maybe Sonia, you and I can talk about this on the podcast, and there could be some additional information that we can share out there, because similar to what, you know, everyone on this call is doing, it's about being able to share these resources, right? So we'll get that together.